All right, I'll go ahead and get started. Hi, everyone. Welcome. I'm Carrie DeSalle, a co-program manager for the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, also known as NTAC for short. We are so excited to welcome you all to today's presentation titled Supporting Caregivers and Young Adults with Lived Mental Health Experience and Contributing to the Crisis Continuum of Care as Peer Specialists. Next. This presentation is being offered through NTAC, which is funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, and all content being shared is that of our presenters and do not necessarily reflect the views of SAMHSA or the US government. Next. Just in case of any security issues that might occur, this session will immediately close down and end and will not resume using the same join link. A separate email will be sent to all participants with further instructions if that were to happen. Next. Before we jump into our presentation today, I'm just going to take a couple of quick minutes to share some more information about NTAC. Next. Our NTAC team is a multidisciplinary team of a collaboration of all the partner organizations that you see here on your screen. Our goal is that all children, youth, young adults, and families with emotional and behavioral health needs can access treatment and services in a well-coordinated system of care. Next, and one more. Here's just a quick snapshot of those that we serve, from state and local agency leaders to mental health workforce, schools, youth, families, peer support specialists, and many more. Next. We offer a variety of no-cost resources, such as coaching, assistance, training, such as today's webinar. So please feel free to check out our website for more information at ntacmentalhealth.org. You can also request no-cost support from our team. Next. And then just a quick plug for our virtual System of Care Summit that we're hosting on May 10th and 11th. Please mark your calendars for those dates. May 10th is going to be a grantee meeting for SAMHSA-funded System of Care or Children's Mental Health Initiative grantees. And May 11th is really for everyone who are children's mental health advocates, including those grantees, as well as anyone invested in mental health and wellness of youth, children, and families. And CEUs will also be available at no cost. So we'll drop those links into the chat box for you all to access later. And then, so with that, I'm just going to go ahead and pass it on over to our friends from Stanford Sierra Youth and Families to go ahead and introduce themselves and get us started for today. Thank you.
Great. Thank you so much, Carrie. And my name is Ebony Chambers. I'm excited to be here. I'm with Stanford Sierra Youth and Families, and I'm the Chief Family and Youth Partnership Officer. I'm going to share a little bit about myself because I do think it is important for us to acknowledge that we all are peers with lived experience and have navigated varying levels of crisis with our own families. We have a large team, which we'll share a bit more about in just a bit, but we're excited to see all of everyone who's joining and the different roles that you have from the different areas across the United States that are joining in today. Our programs our program in large consists of youth and parent partners that have lived experience, that have navigated through the mental health, juvenile justice, or child welfare systems with their youth or themselves, and provide that unique experience back to those that they serve and support with system navigation. And so I share that myself was now my very much older adult. My daughter is now 30 years old, or almost 30 years old, just in a couple of months here. But we navigated that system with her, navigated quite a bit of crisis. And so I bring that experience to my organization, but also to my team members as a source of support in knowing how and what that's like and how overwhelming it is to support with navigation when families are in crisis. crisis. So we'll be talking quite a bit about that today, how our teams provide that support, how we elevate and empower youth and families that we serve, as well as our teams. And with that, I'm going to pass it over to Christina Cagle, Program Director.
Hi, everyone. Christina Cagle. I am the director of our Family and Youth Partnership department because we have several different programs in our department that help support caregivers and youth. And like Ebony shared, I also have lived experience. As a young person, I got to experience what it is to be in a family that did foster care and then help my young adult brother who suffered from significant mental health challenges, who unfortunately is incarcerated due to lack of support, and what crisis looked like for him, and what that support looked like for him. But also as a parent, me and my spouse had a young man join our family, and we also navigated several different systems of care, child welfare, juvenile justice. So it was definitely a challenge, but also eye-opening, and it's a way I can connect with those who are involved in our program, but also what to look and listen for when we are serving our youth and families and what they're expressing as challenges, and sometimes being the bridge between the system that is providing care and what the family is saying. And that's really how we focus our work and support for those that we serve. And with that said, I will go ahead and pass the mic to Tommy Shawalis.
Good morning, everyone. My name is Tommy Shawalis. I'm the Youth Advocate Manager at Stanford Sierra Youth and Families. As both Ebony and Christina mentioned, I also have lived experience in the system of care. As a young queer person, I had to navigate mental health services on my own because of the stigma surrounding mental health services. So I did that without my parents' support. As a young adult, I've also supported my caregivers and navigated mental health services as well. Most recently, I've been a kinship caretaker for my niece and my family. So the lived experience continues. Although there are struggles in that, it's definitely beautiful to be able to use that experience and the knowledge that I'm gaining from my own experience to pour back into my team and to our community. So I'm excited to be here today and speak with you all.
All right, and with that, we're going to share a little bit about ourselves and then as well as our program. And then we're really just going to take a moment to drill in on what and how we do that within our own crisis services. We'll also take an opportunity to cover how we draw down Medicaid dollars as well. And then we'll also have opportunities to answer questions. I'm going to pass it over to Tamisha.
Yes, so Ebony gave a brief overview. As she mentioned, we'll do an introduction, tell a little bit more about our program and what does that look like and how we're embedded into our agency and our services. We'll then move into discussing our support and how we support families in the crisis of care through our 4 levels of engagement with families. I'm talking about how we start and end services with the end in mind and making sure that the family's voice is the center of the services. We'll end out with talking about how we're continuing to elevate and integrate youth and family voice in our service delivery. Our FYP program, Family Youth Partnership, we're responsible for multiple initiatives across the agency that supports community engagement as well as staff engagement. So we'll discuss that as well. Here at Stanford Sierra, we truly work from our mission and values. Our mission and vision, as well as our values. Our mission being transforming lives by nurturing permanent connections and empowering families to solve challenges together so every child can thrive. With our vision being, we envision our communities with safe, lifelong connections for all young people, built and strengthened through generations of empowered families. I really love that our vision captures that empowered families, because that's really the focus of our Family Youth Partnership program, is to utilize our experience to make sure that we're empowering families to see hope and to see that others have navigated these systems and made it over to the other side. So we're excited to begin that conversation here today.
All right. I'm going to now jump in and just talk about our philosophy in action. So family and youth partnership, I'm sure you've kind of gotten the gist of it. We're really connected to our mission and our vision, and really talking about what Tamisha shared of empowering families. Um, our philosophy in action is making sure that we're using one, those who are employed through Stanford Sierra Youth and Families due to their lived experience, are using that lived experience to connect with caregivers, to connect with youth, to share. I get it. And there's nothing like coming alongside someone who has a similar experience. But our philosophy is that we will take that and we'll embed it in all the programs at Stanford Sierra Youth and Families. But also, it doesn't just stop there. Our philosophy is really rooted in nothing about us without us, that you can see that little quote at the bottom. And I say little quote, but it's actually a really big quote, because nothing about us is and was a movement that began with folks saying, if we're going to have policies and practices and systems that are going to impact our lives, and that are going to tell us how to do things, we need to be a part of that. We need to be able to say, if this rule is going to be made, then make sure that that rule or that law or that practice or that policy is really impactful and meets the needs of our families and our children. And so we really take that philosophy through and through in our program, and we'll get into that in a little bit more. We'll go to the next slide. So how we do that is through these various different facets right here. We are co-located in child welfare systems in Northern California counties. We have a program that serves youth that are commercially sexually exploited. We have a housing navigator, or a couple of housing navigators that support a mental health program, a couple of our mental health programs to make sure that families who are struggling with balancing the needs of their mental health, of themselves, of their child, and trying to stay housed. Our housing navigators jump in and help those families understand the resources and the processes that it can impact how housing vouchers are obtained, or what forms need to be completed so that hotel stays can continue to happen. And our housing navigators also have lived experience so that they can come alongside those families who are struggling with being unhomed, be validated in that process, but also plan around what crisis looks like before, during, and after for housing needs. We also have an empowerment training center where we offer various different topics that is to the community, that is to those working within the organization or any organization. And this is empowered by those who work within the program that will either provide a training from themselves or bring in resources to train from this platform, but that will help empower and change the community through various maybe needs that they're hearing about as they're serving families, and families are saying it'd be really nice to have this resource. Sometimes the Empowerment Training Center can help funnel that information. We are in a wraparound program, outpatient mental health services. Our Kinship Navigator program, which I'm super excited about, is going to be coming alongside families who are supporting families and really helping them navigate what it looks like to be a kin provider, because it's a balance. Then we have our Juvenile Justice Program, our AmeriCorps program, and Family Finding. Our Family Finding is embedded throughout the organization. Anytime we are servicing a family or a youth that is not connected to their biological family, we want to make sure that conversation can continue and that we're elevating that voice in that process.
And Christina mentioned all of these programs and connected quite a bit of this to crisis services. I think it's important to really note that all of these programs that are serving youth and families, whether they are in our child welfare program, outpatient mental health, whether they're kinship, or we're doing family finding. All have points of contact along the crisis continuum. They, when someone's housing is disrupted, when a youth is being thrown into the child welfare system or the juvenile justice system, when there's a lack of family connections, those crises are all defined by the youth and the family members, and all very personal and individualized, not defined by us, but really defined by the youth and families that we serve. And so we have to, our family and youth partnership team is listening for when and how families define that crisis, and then the points in which we can join with the families and provide that additional support and system navigation, because we ourselves have navigated those systems as well, and can provide the connection to community resources, additional training for youth and families through the Empowerment Training Center, because our Empowerment Training Center is not just open to staff and community, but also to youth and families to learn as well. And then I think one of the other programs that we don't have mentioned is not really a program, but we do have an array which also supports the crisis continuum of support groups. And so pre-pandemic, we had one monthly support group that was available in Sacramento. We are actually in a large part of Northern California serving multiple counties, and with the pandemic was able to really make some important adjustments that also created more equitable access to youth and families. And so we went from one support group monthly to about 11 monthly, held at varying times of the day to make sure that families can access them at times that work for them, but are also very specific to family and youth needs. So a support group for parents that are navigating youth that identify as LGBTQ, a support group for fathers, a support group for families that are impacted by the child welfare system, a support group for single parents. And so those also support for families as a when we're talking about the different phases of crisis and we think about pre-crisis, these are great opportunities for families to receive support, to build connections, to build their natural support systems. So when and if crisis does arise, there are already strong supports and connections in place for them. And I will pass it back over.
And mic drop.
Christina.
Okay. All right, so this is this Family and Youth Partnership Continuum Impact. This is showing you how our department is in both places. So we're within the organization and we're outside the organization. So at the very beginning, we're involved in the intake process, because what's really important when we talk about nothing about us without us is making sure families understand that they have access to someone who has lived experience at intake. And then as far as the interviews process goes, so those who get hired, every interview, every second interview, because we have a phase of interviews that we go through, we always have someone with lived experience sitting at the table, because we're looking at one, is this person going to be a good fit with our philosophy? But also we're looking, listening, and feeling for those natural inclinations to be, family-centered, strength-based. We want families to feel welcomed by the person that they're working with. And so what you're looking at here is what it looks like at inception, what it looks like in the work. In the work, on one side, we're involved with trainings. We're alongside clinicians in trainings. We are at team meetings. So family and youth partners are on two teams. They're on our family youth partnership team, but they're also on the team in which the program they work within. That way they can provide feedback. They can provide maybe some coaching around practice shifts or things to keep in mind. And then we're also involved in committees. So, the youth and family advocates are involved in county provider meetings. We're provided in county meetings in regards to mental health services or, navigating homeless services. And then on the other side, within the work, we are, as you heard, offering support groups, linkage to different programs for our youth and families to get their needs met, skill building. We also offered what is called shared leadership and resilient youth speak out. And I'm gonna just put a pin in that because it'll come up later when Tamisha comes back. But what's important here is that if we're talking about the crisis continuum of care, from those who work in the field to those who are impacted directly by the work, here we are on both sides. And that's because we can speak to how do we plan before crisis? How do we get in there and support the best way in the middle of crisis? And then what does that post-crisis support look like? How can we make sure we are really looking, listening, and learning from that experience? Because if we don't have someone who's experienced, when I say experience, someone with lived experience sitting at the table and sharing with us through feedback, right? Like this was handled inappropriately, then we're never going to make sure that we're doing the best that we can and reaching our infinite goal.
Thank you, Christina. And I appreciate Beverly's comment in the chat, sharing it's so important to have a seat at the table. And Beverly, I would say we are the table. We, the youth and family services, especially when we're talking about crisis, has to be built around the family and with the family. So we have to have their voice included. And so what you see, what Christina just described, is that at every juncture of the work that we do, from interviews to intakes to supports, that youth and family voice is critical in the development, the implementation, the planning, as well as the evaluation of how well we're doing. And we'll talk about what does that look like when, when we're needing to receive that feedback, and how do we receive it, and then how do we make those adjustments, especially because they're really individualized and need to meet the needs of those individual families. And so we have to really take a look critically at the work that we're doing and be open to receiving those evaluations and feedback to improve our service delivery models. So I'm going to, I'm not going to talk. Christina's going to talk.
This is my last one. This is my last one, and then it's all you. This is just more of the how we do it. So we utilize what is called family-centered practice principles, and that is what's up here and what you're looking at. This is the lens in which we are looking at how services are being delivered to our youth and families, but also how our systems are being built. And this is what we train to. And this is also what we tell our families. We are strength-based. We want to look at outcomes. We want to make sure family voice and choice is the pentacle to moving stuff and making sure programs and system service delivery is there. But this is how we move through and filter information and make sure we're constantly aligned with our mission, vision, values through family-centered practice principles.
Yes, and if you're familiar with wraparound, you'll see these are very familiar practice principles. Stanford Sierra Youth and Families many years ago decided that these wraparound principles were so critical to the success of youth and families that we adopted them as our overarching family-centered practice principles. So regardless of whether we're supporting families in child welfare, juvenile justice, outpatient mental health wraparound, therapeutic behavioral services, whatever program that is, we hold these principles and measure ourselves against them to ensure, especially when families are in crisis, are we looking at these critical factors? Because we know that contributes to the family's long-term success and self-efficacy, that if they've got these natural supports in place, that if we're being culturally responsive, that if we're individualizing the plans and elevating family and youth voice, we see stronger outcomes and shorter bouts of crisis situations because we're honoring these practice principles. So I'm going to talk about services and supports, the direct service delivery model more so for youth partners and parent partners, so peer specialists, through engagement through transition. And so, of course, with that chat, we are kind of taking a look and checking. So feel free as we're going through and describing anything to put any questions in the chat. We'll do our best to try to answer them in the moment, but we do have time at the end for Q&A as well. But we welcome and open for that dialogue to happen, to get your questions answered immediately as something comes up for you. So in that first phase of engagement, family partners or parent partners, youth advocates, also known as peer specialists, are invited to all of the intake meetings for the programs they're assigned. So our team is large. We have about 40 team members, youth and family advocates that are spread across Northern California. And so depending on the program, whether that's a program of 25 youth, because it's a smaller program, or a program of up to 300 youth, that determines how many peer specialists are assigned within those programs. And also the intensity of the program also makes a difference. However, at that intake, I think we all believe that it's really critical to have youth and family partners present to be able to speak to that initial engagement, to be a bridge, to let them know they're not alone, to provide resources within that first point of contact. Oftentimes, especially with some of our outpatient mental health programs and our wraparound programs, and even child welfare, families are in the throes of crisis. They made a referral because there was something really wrong and they were having trouble figuring it out on their own. And so that first point of contact is really critical. And so having a family partner and youth advocate present at that intake meeting to meet with them, to hear them out, to listen to their story, to share a little bit about themselves and be a bridge is really important. And so you see here, what's bolded is that at that very first intake and within that engagement planning process, that a family partner and youth advocate are really there to support and provide any support, along with a clinician and other team members, like a social worker, and so on and so forth, in the immediate safety planning. So this may not be the long-term safety plan, but it's the, what if something happens between this intake appointment and the next time we're doing our assessment and planning? Because we're aware that during that engagement phase, there's also some assessments happening as well. And so they're taking a look at that. And so we, the caregivers and youth are the ones for us who determine the need of support after they've had the opportunity to meet with a family partner and youth advocate. So the level of support, the amount of contact that they'd like to have is really determined by what the family member and what the youth share they're needing. And we are always willing to adjust. So sometimes we're coming into those intakes and our youth or our parents are sharing, caregivers are sharing that they're not interested in this additional level of support, and that's okay. But we've made that initial contact from the very beginning. And then they know that when there is a need or there is of interest, that they have that open opportunity and that access is there and available to them. We also want during that engagement phase to make sure that they have a thorough understanding of how important their voice and choice is, that we cannot and will not do it without them, that we view families as our partners, if not the leaders of their service delivery. And so we really want to make sure that that's abundantly clear for them, so that they know just how critical their voices are to ensuring the success of their family. So we're hearing their stories and hearing what's worked, what hasn't worked in the past. And then of course, we are sharing some of our own lived experience and the resources and knowledge that we have with the families at that process as well. We find that when families are in crisis, oftentimes if a clinician's coming in right away and wanting to do assessments, they're going, but wait, I need answers right now. And so the family partner and youth advocate are also there to help be the bridge for that and to elevate and make sure that the family walks away from that intake in those first engagement meetings, not just with answering a bunch of questions, but also feeling like they have some good takeaways and real-time maybe interventions and resources that they can apply in between while that assessment process is taking place. During the planning phase, this is also another opportunity, and I'll share on the next slide our transition readiness scale. But this, in addition to the assessments that are happening with the clinician or other team members, we also do our own planning with the youth and families. And this directly ties in to, and should always tie into, whatever the treatment plan is for the youth and family. That is but depending on the program, is either the transition readiness scale or the CANs with the caregivers or youth, to determine the type of level of support they need. So our parent partners and youth advocates, when they are doing the CANs, are doing only the sections that are directly related. So they're CAN certified, and they're doing the sections that are directly related to supports, family supports, and resources. So it's very specific to those few sections. They're also working with the family on outlining kind of the scope of work that they're going to do. One of the things that we've learned over the history of our program department and the different work that we've done is that it's really important for us as peers to come in with a clear plan of support, that we can't go in with the family, and sometimes weekly, we call it COWS, which is the crisis of the week, is we don't want to come in weekly and address those cows. We want to come in and be planful and intentional. And the transition readiness scale and the CANs helps us to identify the areas of support that we can offer from a peer perspective. And so we outline that scope of work that we're going to do with the youth and families, so that when we're coming in week to week, while they may have a crisis that's coming up for them, we're coming back to their ultimate prioritized top 2 areas of need. It's not that we're ignoring those other areas, but we really want to keep them focused on their long-term goal and their top 2 prioritized needs. So while we're doing that, we're also in close communication with the rest of the team, and we're sharing that information with them. All of our assessments and plans are also going into the same electronic health record with the other notes and progress notes that are being put into the system by other team members. So that information is very clear, very transparent, very widely shared. In addition to that, and we haven't mentioned this, but something that's really important to family and youth voice is also collaborative documentation. And so while we are writing those notes, doing this planning, we're doing it with the families. That goes not just for our family and youth partnership team, but also anyone that's providing any level of service delivery, is that nothing about us without us is very evident in our documentation. And we collaboratively ensure that what we're writing and is put into their electronic health record is something that they're aware of, and it's not back at the office or in our home offices, documenting those services, that we're doing that in conjunction with them. So here is the transition readiness scale. This is specifically what our parent partners, our youth advocates, our peer specialists utilize with the youth and with the families. So it may be that the youth does one specifically for them and is individualized to them, and the youth advocate is doing that one-on-one work with the young person, or that a parent partner or family partner is doing it with the caregiver and checking in with them. So there's these 7 areas that they're looking at with the families. And as you can see, these are very overarching needs that we know contribute to a family's long-term self-efficacy. And so the family's ability to be able to set their own goals, to advocate for themselves, that they have the ability and knowledge to navigate access resources, that they're able to follow through on a plan or on any task or any interventions, that they know how to manage a crisis, that they have strong support systems, and that they also are clear and knowledgeable on how to manage their own plans. And so when we're meeting with youth and families, we're doing this with them and we're asking them to rate themselves. And then there's an area there for comment. And so you'll see this is an example of one that was completed. And so this caregiver felt that they did really good at setting their own goals. They rated themselves a 5. Advocates, they rated themselves a 4, and so on and so forth. Hopefully the screen is large enough to where you can see that's not too small of the words there on the screen. But what we see here of the areas that are the lowest rated is follows through and support systems, which they rated themselves a 2. So really close to being isolated there. And then the follows through is sometimes. So as a parent, partner, or a peer specialist, they're going to develop kind of their outline and scope of work, and their planning process is going to include how well that parent or caregiver is following through and working with them on building their support systems. And we all know that these are areas that can directly impact crisis, but also as it relates to, say, their treatment planning as well, that all of these areas tie in to any treatment plan, that one can't happen without the other. You can have an amazing plan, but if the family is not following through on it, or they're not able to manage it, or their support systems aren't strong and need to be strengthened, that those are areas that are going to impact the success of that plan that's being developed. And so we really want to sit down and have the honest dialogue with families on where they're at with this. And so we do this within the first 30 days of intake with the families, and then every 90 days thereafter. So we're coming back to this after 3 months and having the families and youth rate themselves again to see where they're at, how they're doing, and what else we can do and they can do to support themselves in that success.
I want to also just share that this is the embodiment, right, of honoring voice and choice of families. We are literally asking them, what do you want to work on? How do we help you get what you need so that you feel like you can hit a 5? This is also an opportunity for us to have, radically transparent conversations with our families. If we did this in our first, meeting and we got all 5s, and all 5s are of high success rate, right? We can say, well, let's talk about this. Let's talk about what all 5s mean, and why you need support or why you think you don't need support, so that we can also make sure we're bridging that for families as they're meeting with their treatment teams. And it's the same for youth. And I'm sure Tamisha can share a little bit about what that looks like from the youth perspective when we receive things at all 5s, or we receive things at all 1s. And how do we start helping families see their growth over time, and what they need to see as growth over time, not what we as the professionals need to see at the time, or what their clinicians need to see, but what would be success for them. And that's what's really important, because if it's that, they went out to dinner successfully, and that could have been through a drive-through, that's a win. And so how can we make sure that is written and communicated to the entire team, to make sure that that is being measured appropriately.
Yes. All right. And so I see a couple of comments in the chat. And so Beth asked, will you get a copy of it? So this tool was purchased through Vroom Vandenberg. It's a part of their book. They've copyrighted that tool. So while we share that we utilize it, and I can, while you all are in breakouts towards the end of this time today, to discuss what actions you can put into place moving forward from our time together, I will pull that and drop the link to where to access the tool in the chat if there is interest for me to do that. So, so thank you for that question. All right. And so moving on to implementation. So the families have, the youth and families have for sure now done that assessment. They've had an opportunity to reflect, but also an opportunity for them to identify, as Christina shared, where their strengths are, where their areas of growth are, and how and what needs to happen to be able to move forward and implement the plan in place. We say that we work with the families with end in mind. We say end in mind thinking because we're always preparing for transition. We're always from the very beginning talking about what does this look like when I'm no longer here, when service is no longer in place. And that's not to scare the families. It's really to start preparing them for thinking about what does success look like without so many systems in their lives. And that's a really important discussion that we feel as peer specialists we can start having with the families right away, because we know what it's like when and if the service delivery or services are abruptly pulled from under us without having those discussions. And so we think that's really important. So through that implementation process, we're also ensuring family voice and choice continues to be honored, that they're connected with as many resources as possible. So those support groups are really important, but we also provide lots of junctures, and we'll talk about some of those in a bit, around shared leadership and resilient youth speak out. So lots of different opportunities for them to not just be a part of or within services, but also learn additional skills outside of that, and be connected to community and within community, which is also really important to success. And we've seen that through the research. We're also in close partnership with our team members, our colleagues, the interdisciplinary team, and we're sharing progress at child and family team meetings, at TDMs, or I'll try to stay away from all the alphabet soup, but transition meetings, if there's a placement change, if there's a crisis planning meeting, we want to be present at all of those to make sure that we're also sharing and making sure that families' voice is elevated throughout the implementation process as well. Excuse me. And so, and during the transition phase, we have a saying called do for, do with, cheer on. And that is actually throughout all of the phases. When we're in the transition phase, we are in what we call the cheer on phase. So we recognize that when families are coming into services, especially when they are in crisis, that oftentimes we might at intake say, you know, oh, here's this amazing resource, give it a call. They'll be able to support you with this specific need. And we come back the next week and we're like, how did that resource work out for you? And they're like, I didn't even try. I didn't even start it. And it's because they're so overwhelmed and they need some support. What we call hurdle help. And so the peer specialist team knows what it's like to need a little bit of that hurdle help. We know what it's like to be completely overwhelmed at times and not, you know, not feel confident in taking that first step because we're just so bogged down with some of the day-to-day and some of those behaviors and other in the environment can just be really overwhelming. And so peer specialists say at that point, we're going to do for, but always with the goal that at some point we're going to transition that to do with, and then cheering them on to do it for themselves. And so the transition phase really puts us into that. We're cheering them on. We've engaged, we've planned, we've been implementing, they've been working the plan. We've also been working with them on adjustments because we know that this is not a one and done system, that there's times that we're gonna have to come back and readjust our crisis plans. We're gonna have to come back and adjust our treatment planning based on the needs and what's worked and what doesn't work for our youth and families. And so peer specialists are also working with them on identifying long-term supports, strengthening their natural supports that really support the long-term sustainability for the families. We also work with them on completing a relapse prevention plan. And whenever we hear relapse prevention, a lot of times teams are like, well, is that related to substance use or recovery models? It can be, but what we do is normalize behavioral relapse. And that's that every youth and families, including myself, when my own child was struggling with depression, that was not something that went away, that even in her adult life, she still struggled with depression. And so coming into services and thinking that after services are complete, that she was not going to be struggling anymore with depression was not something that was realistic and grounded for my family. And so we knew that based on her needs, I needed to be ready and prepared for when she stopped using some of those coping skills and put her back into a place that threw our family before into the crisis situations that we were in. And so the relapse prevention plan really helps to normalize that with the parents and caregivers and talk through, here's what let's expect it and let's plan for it. Right? Let's embrace it because we're human and we sometimes fall back on old habits. I know I do. So it's really important for us to really normalize that with the families during the transition to address for future crisis. This also helps when we're transitioning them out and then like 2 months later, they're knocking on the door going, let us back into services because we didn't do a good relapse prevention planning. And so that first point of crisis again, we see them knocking back on the door and saying, start services all over. We're going to need another year of services. It's like, no, you got this. You've got the tools. We expected for these future crises to happen, that, finishing up these services doesn't mean that at the end, your young person, your child, your youth, your family member is now in this perfect place that no one is. And so we expect for it. And that's another critical success for that transition phase. But we're also doing a lot of celebration. Our youth and families have been engaged in this process, sometimes losing engagement, sometimes frustrated and overwhelmed, and sometimes we're right there along with them. And it's important for our teams to be able to be a part of celebrating, not just in transition, but every step of the way. Some of those small successes where, the family was upset and in crisis about the young person not going to school every day. And now they went to school 3 times that week, and we're celebrating some of those small needle movements that that are happening within the family unit. So we're taking lots of time to be able to do that as well. And so with that, I'm going to pass it over back to Tamisha, but hopefully that was a clear idea of how our teams really work within the teams to support through engagement through transition.
Thank you, Ebony. Ebony just spoke a lot. Can you all hear me? Just making sure. Okay. Ebony spoke a lot about prevention of future crisis occurring in her last slide, and our community engagement efforts and initiatives in our family youth partnership. We are supporting families in that phase, primarily in prevention of crisis from occurring, as well as following up with families after a crisis has occurred and incorporating their voice and how do we move forward. So a lot of empowering is happening with our initiatives. The first is the family youth partnership panels that our agency coordinates about 3 times a year. We're strategically inviting our community partners and stakeholders to these meetings, our contract monitors, any probation officers that we're working with in the communities, as well as our agency staff who are working within the teams of the families, as well as program directors and case coordinators as well. And we're selecting families across all programs within the agency, making sure that there's a full representation of the scope of services that we're providing. And in these panels, we receive the good, the bad, and the ugly. Some families are singing our praises and really speaking to how effective child and family team meetings has been, how communication has been, how their voice has been honored throughout the process. And there's other families who are letting us know that my voice isn't honored. At intake, the clinical services were more guided by the intake coordinator as opposed to what I'm saying my family is needing at this time. So we're offering that real live in the moment opportunity to just have an honest discussion about what can we do to better inform the services that we're offering and to make sure that family and youth voices are truly at the center of the services that we're providing. We provide general panels based on just our services that we provide in the agency. However, we know that other populations can experience more adversities depending on different communities that they're belonging to and operating within. So we have held specialized panels specifically for Spanish-speaking families, for fathers who are supporting their youth in services or who are with their youth in services. As we see and know, most moms are honored and communication is going straight to them. And a lot of fathers are left out of the equation and their perspective isn't honored. So we wanted to make sure that we offered them a voice and asking them, how can we make sure that we're serving you as well? Because when we serve the entire family, we truly serve the youth that we're working with as well. Another initiative that we have really been trying to strengthen is our community partnerships, especially as we're continuing to navigate the pandemic. A lot of specific needs has shown up. A lot of families and caregivers who are working from home and who are also supporting their youth within the home with distance learning. They needed support, they needed respite so that youth could have somewhere to go throughout the day. So we strategically reached out to the Boys and Girls Club in our Sacramento area and figured out how can we partner with them, seeing what services do they offer to youth and families in order to get youth out of the home for the day. And also they're providing food and educational development and employment development for our older youth as well. So a lot of rich opportunities in the community that can support families and preventative methods from a crisis occurring. As well as supporting families who are coming down and really de-escalating from crisis situations and really needing additional support as well. Another need that arose was a safe space, sorry. Just speaking to the community partnerships, our LGBTQ youth, they really needed a safe space during the pandemic as well. So we've been partnering with our LGBTQ community and seeing what services they offer, from housing support as well as support groups within the community on different days of the week as well. Christina spoke earlier about our Empowerment Training Center. There has been some specific trainings that I think is worth mentioning in regards to crisis care with our families. Recently, we had an ACEs training, really speaking to the adverse experiences that our youth experience in the community and within our services, and how we should be mindful to that and responsive to that as soon as we're aware of them, as well as suicide prevention. I think we've also been navigating a mental health pandemic with our youth during the past couple of years. So really talking about the telltale signs of youth who are battling suicide ideation and how we can be responsive to that as well. Excuse me, sorry you guys, battling allergies. We're also talking about families who are experiencing family violence and domestic violence and the impact that that has on caregivers as well as the youth in our services, and how we're responsive to that and how it builds upon the mental health challenges that are present in families' homes as well. Ebony, I'm gonna pause because you came off mute and just ask if you, no? Okay, gonna keep going. Last but certainly not least, our shared leadership group is an amazing opportunity to provide a seat at our table, as Ebony mentioned, for folks with lived experience. This group is our caregivers who were previously in services or who are currently in services. And we're working with them as consultants and asking, where can we improve as an agency with our policies, practices, and procedures? Currently, they're reviewing our on-call survey list, our survey questionnaire. So our family youth partnership team, after any family reaches out to our on-call system, which operates whenever are outside of our operation hours and our weekend hours. We're calling families to see how their experience has been. Was it culturally responsive? Was it timely? Was it trauma-informed or trauma-sensitive? And they're currently reviewing those questions to make sure that they are effective and that we are asking the right questions and responding in a way that families feel most helpful and necessary. So that's what they're currently working on. But whenever we have something that we're rolling out that affects our families across programs, we're making sure that we're asking our caregivers who have been through these services and these experiences for their expertise and how we can continue to elevate our services.
I would also add that when we share that that they are consultants, that they are also paid consultants. So you know, our families that are operating in shared leadership with us, our families that are a part of our youth and family panels, our youth that are a part of RISO and are speaking to incoming social workers about what is it like to navigate child welfare system and what do they need from their social workers. Those are all training opportunities. Those are all opportunities to help us improve our practices for the community. And I cannot help but really be clear that it is important that if we are asking them for their time, their input, that we value that through compensation. And so we provide stipends for their participation on panels. We consider those staff training, so they are our trainers. And so they receive compensation for that, as well as the shared leadership meetings that are happening monthly that they receive. If they're in person, they receive transportation assistance, as well as the stipend for their participation and their feedback. And the same goes for RISO. Even a RISO with an alphabet soup, Resilient Youth Speak Out, which I'm going to actually pass it back to Tamisha in just a moment to talk about a little bit about RISO, because that's another part of community engagement. And these Empowerment Training Center, Shared Leadership, RISO, all are available to families within our organization, but we have also opened it to community as well. So Resilient Youth Speak Out also is available not just to those receiving services or past service recipients, but also one of their friends or you know, other family members. The same goes for our support groups as well, all available and open to all of the community. And so now we can have folks dropping into support groups that are on the East Coast. They're all free, and it's all available to any community member, because we know that access is important. So the more we can create awareness for that, the better.
Absolutely.
I just want to jump in and just say this is also about equity, right? When we are compensating our youth and families for their time and their expertise and sharing their lived experience. That's what we would do for an expert that would be coming in and providing that training. And so when we talk about equity and when we talk about really honoring voice and choice, it is really important to make sure that we are providing the same extension we would to someone who has a specialty or a very specific degree, because that's their experience and they are offering a specialty. And so this is how Stanford Sierra Youth and Families make sure that we're honoring voice and choice with honor and equity.
I would also add in education, Christina, with our RISO group. As Ebony mentioned, we opened it up to community members and friends of youth as well. And over these past few years, we've had a lot of youth join, and they're like, well, I don't have any lived experience. And the more we connect with them and talk about the work that we do, they're talking about community violence. They're talking about their interaction with cops. They're talking about gang violence. They're talking about their anxiety and depression, and don't have the language to put to it to even know that it is mental health that they are navigating. And I think RISO is an amazing group for that. It's a lot of natural peer connections and peer mentorship happening. We have 3 youth leaders that really guide the direction of that group, and they're letting us know what youth are currently experiencing and what we need to be responsive to as well. And because of these youth being so vocal and transparent and sharing their stories, we've had local universities reach out and ask, can these youth come and speak to our social work students? And they're talking transparently about what they didn't receive from their social worker or what they did that was helpful. And it's really necessary to have that lived experience perspective. As a former social work student myself, I had my own lived experience, but the more I learned about others, it was more informative to me than a lot of what I was learning within the classroom. So we're always offering these students the opportunity to share their experience with upcoming social workers, as well as those who are currently working in the field, if we see an area and a need for change. And I see your comment in the chat. We can share the flyers for these groups. Absolutely.
Yeah, they're happy to share those, and please feel free to distribute widely to the community, because we love to have community members and supports be available to any and all who have those needs. And so I think, we've shared quite a bit, and I want to just really highlight how important it is to be aware that addressing crisis along the continuum takes this multi-pronged approach. So we talked about the service delivery model from engagement to transition, but it also that community engagement and trust being built with service providers, so that when there is a crisis, that they feel comfortable in reaching out, that they feel confident that those that they're engaged with will be there and show up for them and support. So that ties back to our on-call systems, but also what kind of follow-up we're doing in those on-call systems. And Tamisha highlighted that it's family and youth partnership teams that's reaching out after crisis and checking in with them and asking those questions, but also making sure that they are aware and linked to the resources that we have available at the organization, and that they know if they would like to utilize their voice in shared leadership or RISO or through Empowerment Training Center or through a parent and youth panel, that they have that opportunity as well. So really making sure that as we think about crisis, we're not just thinking about it from direct services, but also what we're communicating, what's our forward-facing communication to community members, how are we interacting, engaging with them on different media platforms, how do we talk about families when we're out in the community? Does it sound like we're in partnership with them, or does it sound like we're just doing for and not partnering with and elevating youth and family voice? All of that really does impact when we're supporting crisis, what that outcome looks like based on the trust and engagement of our communities. So we cannot just take what we're hearing when we're having those youth and panels and say, thank you for that feedback. We have to be able to put active plans in place to address it, follow up specifically with our program leadership, to ensure that they're making the necessary changes from those feedback loops, and ensure that those are being implemented effectively, so that it's just not a checkbox of hearing voice, but actually making change and system transformation. We've got some questions, and we hope we don't lose you here. Whenever we move to breakout, sometimes we see folks taking off. Don't take off. This is such an important part of our time today, because we really want to make sure that when we're talking about supporting families on the crisis continuum, that we have some opportunity to take some things back to our organization and make some changes immediately. With online learning and virtual environments, it's really easy to log in and have a one and done, but we really, really want to make sure that we're having thoughtful, intentional discussion around what the next steps are. And so this is a critical, important part of the success of this portion, is to have these discussions. And so we are going to take a moment to move into some breakouts and have a discussion around how are youth and families made aware of the current crisis prevention and intervention supports in your community. How are you incorporating youth and family voice in your crisis planning? And so we shared some strategies. Maybe there's some opportunity there for you to think about what you might want to implement for yourselves. What resources do you need to continue to explore this further, or trainings? Maybe it's utilizing the transition readiness scale. Maybe it's peer specialists leaning on the CANS assessment tool. And then what stakeholders do you need to involve? Are you including youth and family voice in the planning of your services? And if not, how will you start to engage them? What does that look like? And I see that Carrie also dropped these questions into the chat. So with that, we are going to take a moment to go into those breakouts. We'll have small groups, so you can have this discussion, and then we'll come back and share. We'll answer any questions, and we'll have the opportunity to close up. I think 10 minutes, about 10 minutes, 12 minutes into the breakouts would probably be a good amount of time. So we have time to come back, report out, and close up. I'm gonna stop sharing now. See you at the next one. All right. Well, welcome back, everyone. We have the breakout discussion questions still here in the chat. And so we just want to take a moment before we move into Q&A and close out to check in and just have open dialogue discussion around what came up for you during the breakouts. Is there anything, any takeaways, any questions you were able to answer that there's opportunity for you to maybe move the needle or do something differently as it relates to the peer specialist supporting youth and families in crisis? So feel free, anyone, if you want to, feel free to use the raise hand function, feel free to use the chat. We're open to any and all things. Unmute yourself. We'd love to have the dialogue. I see Carolyn, is it Caroline?
You got it right. It's Carolyn from St. Augustine, Florida.
Hi.
And one of the resources I didn't get to say, but I would love to see more programming like this. I'm really having a good time here today. Talking with some of the people I was in the breakout room with, I've just got some quick takeaways, how we can promote our services in my local community. I think I would aspire to a walk-in mental health clinic like they have in Milwaukee, standalone community resource centers throughout the community of, was it Charlotte? The other thing is there's one of the states is putting the crisis hotline number on the back of school students' school ID cards, which I think is brilliant. And we can do that. That would be easy.
Right. Yeah, more opportunity for here's the information you need to know, and it's on something that you carry on your person all the time. So you've got the information right at your fingertips. Thank you for sharing that, Carolyn. And also just in regards to that access, that walk-in clinic as well, another great way to increase access and reduce barriers for youth and families, especially when they're experiencing crisis. So thank you for sharing that. And then I see in the chat, Christy shared, you talked about being able to provide choices for young adults and families. And that is so important, is to know that you've got options and that there's just not one prescriptive plan in place for youth and families, that there is an array of options for them to be able to access, and they have the choice in what they can access and what works for them. And that helps and really is in alignment with individualized support, which is one of our family-centered practice principles. So thank you for sharing that, Christy. And then Tabby, I see your hand is raised.
Yeah, so one of the things that we do in ours, specifically for maybe those people who don't qualify through the natural means of, systems, we have a community outreach portion. We partner with community and schools. And so it's essentially offering a stopgap that those people who may have private insurances, those students who might not quite qualify for an IEP or a 504, but are still having large challenges. What we can do is, because we received a grant for the community and outreach, we are actually able to still offer family support partners and youth peer support partners to them through that sort of informal system. So they're still getting the benefits of peers while still being able to search for other resources through private insurances and other means. So that's something that has been really helpful for us to help those people who, you know, are kind of on the no man's land.
Absolutely. We have that same model here in Sacramento County as well, and it's very helpful for those not directly connected just yet, that they have access to peer partners that can help with that connection and like walk them through what those steps are. Because I have even, tried to access Medi-Cal services and walking through it with a family. And I'm like, holy smokes, this process is overwhelming. Like I'm in crisis just from having to try to navigate it. And so I think those are those important factors that really help to break down some of the barriers, that help to increase equity, is making sure that families have folks that can walk through those steps with them, and that do for, do with, cheer on, right? That's when that's really kind of being elevated, when we see that that extra additional layers of support being available. So thank you for sharing that, Tabby. And I see some discussion in the chat, the crisis info on the back of all student IDs. Yes, brilliant. Yes, I have a 14-year-old, and it is a freshman in high school, and they just recently this school year incorporated those on the back of the IDs. There wasn't typically there for my other kids who were in high school, and I think that's a great way to also normalize seeking support and reducing the stigma around mental health, and having those resources available in multiple settings so that we can normalize those discussions for our youth as well. And I see Michelle here also shared, they have mental health providers in all the schools that students can access, as well as the community providers.
It's really beautiful to see how the system is responding to the youth, because it's really the youth who are saying, let's normalize getting support with our mental health. And I almost I appreciate this young generation because, while some people will say, well, they don't understand and they don't know. But if we just sit back and really look and listen what they're saying, they are literally changing how we're going to take care of ourselves. And how the world is going to take care of themselves, because they are saying we need the support. Where are my people that I can go and talk to? And they're holding each other accountable. These young people are recognizing where they need support and are doing something about it. And shame isn't following them maybe the same way that their parents' generation or grandparents' generation has impacted them.
Absolutely agree. And I'm seeing lots of conversation in the chat around needing follow-up from this call, a central resource about these ideas and database of peer programs across the country. Absolutely, especially for participants. How do we find peers, right? How do we talk about these different programs? It's a great idea that I'm going to pitch back over to Miranda, one of our hosts, to maybe explore further, because it is absolutely, I think, a need. And the more we're able to share that information across organizations, especially with 988, right? We're on the cusp of 988 and addressing crisis, and ensuring that families have this access, and that youth and families have supportive measures in place. And we're seeing now, and research is showing, that peer support specialists are an important factor to that. And so knowing how the different organizations operate, what are their strengths, how are they drawing down Medicaid dollars, are all really important to kind of understanding that. And the more I think we can share information, the better. So it's a great idea, Wendy. And so more comments, and bear with me. I'm just kind of taking a look, and feel free, if someone else wants to share, feel free to unmute yourself. I am mindful of time. It is 10:23. I'm seeing there's the National Warm Line. Thank you, Tabby, for putting that in there, warmline.org. And it has a national listing. So thank you for sharing that. And then Colorado just started offering youth three free parenting. Oh my goodness, I am not going to say this correctly because it's like a tongue twister. 3 free therapy sessions, and it's called the I Matter program. Very great. So lots of different learning opportunities that you'll see here in the chat or resources. So thank you all for sharing those and keep dropping them in. We appreciate that. And I think this is how we all learn from each other, is sharing these ideas and resources and next steps that we can consider in our own communities and jurisdictions. So I'm going to go back and actually share this screen. And Tanya, I see your hand is raised. Just want to.
Oh, sorry. I was just bringing mention to what Sheila had said in the chat, bringing that faith-based group. And one thing that she had also mentioned is one of my what I'm trying to get back together now is peer support, sharing our stories, and as professionals, training alongside the professionals we work with. So not only training them, but sitting with them at the same tables. It's what I did in another locality, and we had judges at the table, social workers, peers, everybody was trained in the same language at the same time. So I would go in, share my story, and then I would sit down and be trained right alongside them. So as we are supporting our peers, we know the verbiage to use the same way that they did. And now that is something that I'm working in my locality, training the school system, training law enforcement, just because we know what it's like to sit in front of these people. When I had tears in my eyes, and now I can stand in front of them, in my red lipstick.
Yeah, that's great. And I appreciate the nod to the faith-based law enforcement, social work, like all of these different folks all have touches with families and youth along that crisis continuum. And so the more we're all norming and speaking similar language, understanding trauma-informed care and supports, the better. And so all of that organizing with our faith-based communities is all a part of being very culturally responsive. And so it's important for us to, be in close contact and communication with all of those folks. So thank you for highlighting that. Yes, and Miranda said all child serving systems need to be a part of the overall system of care. Yeah, so developing language across sectors, it's very hard, but it's also very important work. So the more frequent it touches, and that's when we talked about those community partnerships, that's exactly why we do it. We know that the Boys and Girls Club has multiple touches with a lot of our youth and families. So we need to make sure that they're trained in trauma-informed practices. And so we do that, and then they're also providing our families with respite, and it becomes this beautiful partnership where we're no longer operating in silos. And at the end of the day, the families benefit the most from those partnerships and those dialogues. So thank you for sharing that. I am going to go back and share this slide. So thank you all for participating in the breakout groups. I'm going to just move us through here and do a last a call for any last minute questions. If you have them, please put them in the chat. We will respond. And Christina and Tommy, if you don't mind putting your contacts, my email in the chat, I think that would be really helpful as well for folks. But feel free to put that in the feel free to put questions in the chat, and we will come back and make sure that we get those answered for you. We can't thank you enough for attending today. And we really want your feedback. And make sure that we can, Interact can continue to bring you those free resources. I'm going to pass it to Carrie to close us out.
Great, thank you so much. Thank you all for attending today. Again, just please, if you can, take a moment and click on that link that Joanne dropped into the chat box and let us know what you thought about today. Share any topics that you may be interested in for future learnings. Again, we did send out a copy of the slides in the email reminder that went out earlier today. They can also be included in the follow-up that you'll get momentarily. But a big shout out, thank you to our presenters, Ebony, Christina, and Tamisha from Stanford Sierra Youth and Families. Their team is going to be providing 2 additional learning opportunities for us, one on April 7th on best practices for continuity of care before, during, and after stabilization services. And on May 4th, they're going to be offering a diversity, equity, and inclusion training focused on health equity within the crisis continuum of care. So please look out for more details on that and registration links coming soon. Again, all of our upcoming events, as well as information about our 2-day virtual System of Care Summit is on our website at ntacmentalhealth.org. Feel free to reach out to our team at any time. There's links to requesting no-cost support. And once again, just thank you for your time today, for your participation, and hope you all have a great rest of your day.